lead clinical psychologist at the British CBT and Counselling Service. And in this video, I'm going to be talking to you about cognitive behavioural therapy for anxiety. Cognitive behavioural therapy, or CBT, is currently the most effective treatment that is available for anxiety. Before we look at that though, it's important that you are sure that anxiety is the problem that you're dealing with. So, do you find that your heart is often racing or pounding? Do you often feel dizzy or worry about losing control or fainting? Do you find yourself often fearing that the worst will happen? Or that you are frequently avoiding the situations that make you feel uncomfortable? And are you finding that increasingly the decisions that you make are influenced by your anxiety? Now, if you have answered yes to one or more of these questions, it is quite likely that you are experiencing anxiety and that a course of CBT could help you. Now, as I've said, CBT is the most effective therapy that's currently available for anxiety. However, not all CBT programs have been created equal, and it's really important that you find a therapist who can individually tailor a program to you and what you need, that they're not just delivering an off-the-shelf program that they use with everybody. Now, it's easier said than done to find a therapist who can do this. It will be principally determined by their qualifications and their training. But in the next video, I'm going to look in a little bit more detail about how to choose the best therapist for you. But in the meantime, let's look at what a good CBT program involves. So there's 4 key stages. The first stage is an assessment stage, because everybody's experience of anxiety is different. So your therapist needs to know about your experience so they can tailor the program to you. So they'll ask you a selection of questions, including when did your symptoms start, what triggers your anxiety, what your specific physical symptoms are, what sort of things make you anxious, what situations are you avoiding because of your anxiety, what makes your anxiety better, what makes it worse. And they'll also ask some more general questions about family, work, interests, so they have a context, so they can understand a little bit about your life. And this is really important if the program is going to work for you, if it's going to be individually tailored to you. The next stage is where you start to look at reducing your anxiety, but also building your confidence that you can manage situations. Now, in CBT, we think about anxiety as being triggered by the types of thoughts that we have. So anxious thoughts lead to anxious feelings. So in this stage, you'll look at identifying those thoughts, then evaluating their accuracy and their helpfulness. And if they're not accurate and helpful, you will look at developing alternative thoughts which will induce feelings of calmness and relaxation. In this stage, you'll also look at beginning to challenge or test yourself a little bit so that you can build your confidence in your capacity to cope. In the third stage of therapy, and this will begin once your day-to-day symptoms of anxiety are much more reduced, much lower, and you're feeling more settled in yourself, you'll begin to look with your therapist about what has made you vulnerable to developing the symptoms of anxiety in the first place. And this is important because anxiety doesn't just strike randomly. There will be something that has happened to you in your past that has made you vulnerable to developing the anxiety. And it's really important that that's identified and dealt with so it doesn't continue to have an impact on you in the current day. Otherwise, your symptoms of anxiety over the course of time will just return. And the final stage of therapy is to consolidate what you've learned, but also to build your confidence that you can manage without therapy. So in this stage, your therapist will be setting you tasks and challenges to build your confidence that you can manage. So that's good CBT for anxiety in a nutshell. If I haven't managed to answer all of your questions, please post them in the comments and I'll do my best to help you. And I'll see you soon.